Hey, my name is Leslie Sams, and I'm the development manager with Ubora, Tanzania. And I am here to share with you about the amazing things that God did in 2020 in spite of the pandemic in getting biomedical equipment, supplies, and medicine delivered to the Siha District Hospital in Tanzania. The Siha District of Tanzania has 139,000 residents. And prior to the hospital being built, the only way that they could get any kind of medical care, medicine, that type of thing, was through local dispensaries, which were often not well stocked, or people could not afford to pay for the medication, or if it was not there at their dispensary, they'd be referred somewhere else, which was often too far away for them to go. So they just went without. And the hospital was built, started being built. It was a clinic at first, and then by 2019, it was seeing inpatients in its original building, and government finally was able to have the buildings fairly completed by early 2020. There's still a little bit of work to be done on some of the wards, but they've got the capacity now, as far as buildings go, to receive patients in a lot of different areas, but unfortunately, most of the rooms are all empty. And so that's where Ubora came in, and through a lot of wonderful, happy, providential meetings, we were able to supply them and begin supplying them with medicine. They'll be given away free of charge, and the dispensaries will have access to it as a hospital. And then the equipment, beds, x-ray machines, baby incubators, gloves, masks, just the list goes on and on and on of all that was able to be shipped over there to begin supplying the hospital with all the things they need. So the goal of the government is for each village to have a small little pharmacy. Think of it kind of like a closet, just a little closet. They're called duka la dawas, which is shop of medicine. And people can go there and get very basic things, maybe Tylenol type items, just a closet CVS, if you will. So every village is supposed to have one of those. And then it moves out from there with going out to the ward level. There should be a larger dispensary. And then the government started this initiative that resulted in the Siha District Hospital when they determined that every district should have a hospital. So, but you need to consider the fact that that's a district of 139,000 people who have this one hospital to go to, right? Many have the chronic conditions, diabetes, high blood pressure, those kind of things that we can find medication treatment for very easily. They do not have that. So they will go without, and of course, lots of complications, especially with diabetes, but also high blood pressure and other things like that will go untreated and cause, early death, amputations, things like that, that could be easily prevented if they had the medicine. And that medicine was on our containers. Antibiotics, antifungals, fungal infections are really common, especially in the children, because they, play in the dirt and all of that. And those can be easily treated with medication if they had it, with the antifungal creams. But sometimes what we've seen in some of the clinics is that those, and they usually get them on their head, and that will go untreated, and it will become, really bad sore and get infected, and then they don't have the antibiotics for the infection. So it's a vicious cycle. One of our core programs is the health program. And we have had, we've sent over medical teams over there for a number of years now. And we started off just having them see the children at our school, at Siha Leadership Primary School. And they give them an annual physical and check on them. And we started then branching out into neighboring villages and doing clinics with public school children that were in the surrounding areas, and seeing a great need there. And so that's been, along with our annual visit to our school, that going out into the community has been more and more of a priority as the years have gone on. And now that we have a very well established health pillar, we really want to see that grow, especially, once we can go back over there. We're really working a lot of initiatives to see that that part of the ministry grow and reach more and more people, not just the children in the government schools, but also the villages, the community, maternity issues, things like that, and to really come alongside the hospital and find out what their needs are, be able to address those. Training, we're looking at helping to train some of the people in the hospitals, their medical professionals with our medical professionals, and a lot of neat things coming up. Yeah, we couldn't have gotten the medical containers over to Tanzania without the assistance of MAP International and MedShare. MAP International is based in Brunswick, Georgia, and they ship medicine over to third world countries. It's close to its expiration date, but it's not going to expire before it's used. It's safe, but America has very, very high standards. And once you hit a year left on an expiration date, a lot of times the medicine is just given away. And so MAP collects all that and has a huge warehouse down in Brunswick, and you request what you need and they find as much of it as they can and pack those containers up. And then MedShare, which is based in Decatur, Georgia, does the biomedical equipment and supplies. So they will guarantee that you have a certain amount of biomedical equipment, a certain number of big pieces like X-ray machines, baby incubators, gurneys, wheelchairs, that kind of thing. And then they will add on 1,000 boxes or more of supplies like gloves and masks and sutures, and just you name it. They have a lot in their warehouse as well. So that all got packed by them and went over. Nothing happens without donors. We had a couple of family foundations who gave very generously to the project. And then we also had the doTERRA Healing Hands Foundation do a matching gift for us. And we're very grateful for that. And then just hundreds and hundreds of our donors who sponsor our children through our Project Child program, who are just friends of the ministry and who saw this need and wanted to meet it. And so all of those came together in order to make this happen. And if one piece and one person had not been in the mix, it wouldn't have happened. Yeah, this right here is a picture of the front of the original building. And this currently is where all inpatients will be, and you'll typically find 5 or 6 moms sharing a room and delivering their baby and recovering all in the same room. They have since built more wards. The buildings are beautiful and it's going to be a beautiful campus. But as you can see on the right, most of these rooms have been empty. And so this is the NICU where babies are supposed to come and and get emergency care, and the only thing there is a sink. So and in addition, the administration block here still under construction. The labor and delivery room still empty. There were some beds the last time I was there that will be put together for being there, but then our containers came. So the one on the left is full of about $2 million of medicine. And the one on the right is filled with about $500,000 of supplies and equipment. So that came to the hospital, and this is now what they have.
Wow.
So now we have crutches and walkers and boxes of medicine and gloves and gowns, and you see the exam table and the gurney and wheelchairs, and I mean, there's just all sorts of things that they now have. So it's very, very exciting. They're still in great need. They still need to have um, another shipment or two, and we're praying that God will pave the way for that as well. Yeah, one of the things about Africa in general is that there are things that happen there that just don't even occur to us, and it just is typically things that would not happen really even in the lowest income areas of our country. But one day, Dave Burgess, the president of Ubora, and I were talking with Dr. Method, who was the district medical officer at the time. And we were standing outside the hospital. We had toured all of the buildings and looked at the progress that had been made since I had been there in February of 2020. And we were just a few weeks away from those containers arriving. And he told us a heartbreaking story, but one that also encouraged us as well, because he said that just the week prior to our coming, there was a woman who had actually died in childbirth. And the doctor who was attending her actually knew how to do the procedure that she needed in order for her life and her baby's life to be saved, but they didn't have the equipment to do it. So they transported her to another hospital that was over an hour away, and unfortunately she died on the way there. So he looked us in the eye and he said, the equipment that we needed is on that container. And I still get chills when I say it, because that means that that's not going to happen again. And we could there's probably lots of other pieces of equipment and seemingly small items that came over where there will be stories like that, where lives will be saved. At the very least, lives will be changed in a huge way by having access to medicine and equipment and supplies that they haven't had. So many volunteer opportunities within our health program. First would be to go on a medical mission trip. If you are a medical professional, nurse practitioner, PA, MD, RN, whatever letters you have behind your name that makes you a medical professional, we need you to be on medical trips. And once we are able to go over safely, then we will start going at least 3 to 4 times a year to have the clinics. And so we need all kinds of people to go on that. Also, we do need people to go on the clinic trips who might not be medical professionals, but who would be willing to be helpers and to also share the gospel, because we have a triage tent that's set up, and the children and villagers are triaged there as to who they need to see and how quickly. And while people are waiting, there's an opportunity to share the gospel of Jesus with people. So we need people that would be willing to do that. And also in the evenings, there is a lot of work to be done as prescriptions are filled and labeled and assembled to be handed out the next day to the people
So
that have been.
Like administrative tasks, really,
Yes.
that anybody can do.
Yes, and so it's always welcome for people to come on the trip who aren't medical professionals, but who would want to just help out with tasks, be a runner between tents, things like that. Another opportunity is in the global health arena for people who are global health professionals. We are undergoing an initiative right now. We started it in 2019. It came to a screeching halt last year, but we are wanting to train the 120 community health workers that are in the CHA district. There are 60 villages in the district, and there's 2 community health workers that are elected by their village, a man and a woman. And their job is to really kind of keep their hand on the pulse of the health of the community. They train the community and the village in WASH, the water and sanitation health initiatives, how to dig proper latrines, where they should be washing their food, how they should be washing their food, how to wash their hands, why it's important to wash your hands, as well as nutrition, helping the villages with standing water issues so that mosquitoes that carry malaria aren't breeding, and also just visiting and keeping an eye on people that might already have a chronic condition, or even just seeing children playing in the village and saying, what's that sore on your knee there? And so they have access to some first aid items, and then as well as directing people to one of the dispensaries or now to the hospital. So we are eager to get them trained in these 210 hours that are required by their government.
Yeah, that's quite a significant training. I mean, they're going to learn a lot.
It is a lot. We did our first pilot training for the CHWs in 2019, as I mentioned, and they got their first 40 hours. And we're wanting to do, I believe it's going to be set up in 3 over time. And now that we've learned even more about doing things remotely, we are going to not only do in-person trainings there in Tanzania, but also we do now have capability with a big screen TV that has been set up with fiber optics at the hospital so that we can have trainings there with people that are here. So there's that opportunity as well. But this is Dr. Method, who worked tirelessly on his end to help us get the MAP and MedShare containers over there. He made at least 3 trips to Dar es Salaam, which is a good 8 to 10 hour bus ride. And I've done it, and it's not a pleasant ride. And he did that at least 3 times in order to get paperwork, just go through a lot of government red tape in order to get those. So this is just a little thank you from him.
Asante sana, which means thank you very much. That's what I would like to say to all Ubora partners for the shipment of medicine and medical equipments containers to Sia District Hospital. And this medicine and equipment, which are basically life-saving equipment, they're going to save more than 139,000 population in Sia District. And basically, when we opened these buildings at the new hospital in 2019, whereby the government funded the construction of wards, diagnostic buildings, etc., we didn't have much equipment to start to do our operations. We didn't have much equipment to start seeing patients in the new buildings. But once we received these equipment, which are very essential, we are able to open almost all the buildings, which are functional now. And basically, patients now, they get care at this hospital. And I'm very sure that by doing that, we're improving the quality of their life, because so far we have saved a number of patients from traveling very far to for medical services, but also we have saved patients from dying because of lack of basic medicines and equipment. So I would like to thank you very much all the partners who contributed to this, and I hope that in the near future they are going to support us with more containers of equipment and medicines which are essential to this district, so that we can continue to save life in this calling of God, which we basically we have to contribute so that we can save life for the people in this district. So I hope that they're going to support us once again, and therefore I really thank you very much, Ubora, and all the partners who made this possible. May God bless you all. Asante sana.